I'm Greg Jamian, and thank you for watching Boomer Health at Home, the show where we explore the most relevant healthcare topics impacting the baby boomer generation today. As more and more baby boomers seek answers to many times difficult healthcare questions, our goal is to provide ideas, tips, and cutting-edge solutions that will help improve your everyday life and health. It is our hope that you find the following information helpful as you sit back and watch Boomer Health at Home.
Hello and welcome to another episode of Boomer Health at Home. I'm your host, Ryan Donnellan. Joining me, of course, is the always interesting but never on time co-host, Brett Pulte.
You know what? Sometimes it's better to not be on time. It's more interesting that way.
Very good. Keep it interesting. Most interesting man in television.
Well, I try.
So what do we have going on in today's episode?
Today we have Joyce Ward joining us, and Joyce is actually going to take us through the ins and outs of home care.
Well, very good. So different elements of home care, I'm sure, is I know we spoke with her once before. Be interested to see what she has to bring to the table today.
Yeah, you know, Joyce is an RN. She's been working in home care for a long time, and she's super knowledgeable on the subject. But not only that, she can lay out, you know, exactly what you're going to look for your parents, for yourself. You know, it's someone coming into your home. You got to make sure you trust them, and you got to make sure you know about it as well.
Right, I know, and it's always a confusing thing. If someone's even considering you at home, considering home care, the main first question you should always ask is where to start, and it's right here. So don't go away. We'll come back with more information on home care, and you're watching Boomer Health at Home. Welcome back to the show, and please join me in welcoming our special guest, Joyce Ward. Joyce, thank you for being here today.
Well, thank you for having me.
You know, Joyce, doing the show and just in the work field, I talk to a lot of people, and when it comes to home health care, I think there is kind of a bit of a confusion and almost a surprise element sometimes when people learn how much can actually be done in a home when people are facing that decision for a loved one. Do we, send them, what can we do with them if we can't care from ourselves and all that? So I was hoping we could talk a little bit about that today.
Yeah, I'd love to talk about that. Healthcare, home health care has come into vogue more in the last 10 to 15 years, and it was realized how much of an advantage that can be in the healthcare continuum. So you're hearing more and more about it these days. Great.
Now, in your professional, I know you've had a lot of medical professional experience. What has been your interaction with home health care services?
Well, I started out as an ICU nurse at what was then the Oakwood Hospital, and from there I went into a home care field. I was a field nurse for the same hospital system, and after some while with that, I became the manager of nursing care for the home care agency for Oakwood for about 4 years. I then went into case management, hospital case management, became certified, and I was a hospital case manager, and from there I became a manager of care management for one of the community hospitals within the system. And essentially it's discharge planning, which has a lot to do with transitioning the patient from the hospital setting back into the community and utilizing home care services. So you have kind of a long tenure with home care services.
You know, that's great to hear, all the knowledge that you have and experience that you've had. But what are some of the services that home care can provide to a patient?
Well, that's kind of a complicated question. Okay, there are many different levels of home care. Most people become familiar with it, especially when they're taking care of an elderly parent or somebody that's hospitalized, and they transition them back home with home care services, which are short-term services which are covered by Medicare and Medicaid. Some younger patients are now receiving home care services. We're doing joint replacement and those kind of things at a younger and younger age. And most commercial insurances or employer-provided insurances will also cover home care services as well. And it's just been found through experience and actuarial tables with different insurance companies that the patient outcomes are much better when you have those services in place rather than just sending somebody back home and having them check in or follow up later. So
yeah, no, so a lot of families may be sitting there at home right now thinking, I've thought about this for my mom, or thought about this for dad or something. But not knowing, if they're not in the medical field, their question may be, when should they consider home care? When do you think that that's the most beneficial?
All right, we should probably talk a little bit about what types of home care. There's really two different divisions of home care. There's the insurance covered home care that's covered under Medicare, Medicaid, and most private insurances. And then there is private pay home care, okay, they're actually two separate issues. Private pay can be utilized to support somebody in the community when they're having a little bit of trouble with cognition, activities of daily living, being unable to bathe. People get afraid to fall in the bathroom. Yeah. You may notice that you visit, especially in our mobile society with everybody being so spread out, you may see your parents only 3 or 4 times a year on holidays and so forth. You may notice a decline in their ability to remember things. You may notice the environment's getting a little unkempt and disorganized or dirty. Personal hygiene issues may crop up. They may be repeating things. They may not be taking good care of their finances. It may be shocking sometimes to see the quickness of the decline when you're visiting intermittently. But just kind of watching for social isolation, not taking an interest in activities like they used to, those kind of things. And the family are probably the best people to make that assessment. They know their loved one, where a doctor's office visit or somebody that only sees your parents or loved one occasionally would not know that. So you kind of have to keep an eye out.
Right.
And that's really good. Like you say, keep an eye out for different changes in their activities and stuff. So how can home care be an alternative to rather than a nursing home?
Okay, well, we should talk about nursing home services first of all. Medicare, most people are very shocked as a hospital case manager when I was discharging people to a nursing home. We're shocked to realize that Medicare only covers 100 days per condition, and that's for standard Medicare. Yeah. And they only cover the first 20 days at 100%. After that, there's a 20% copay for the remaining 80 days. A Medicare Advantage plan usually only covers 45 days per condition.
Wow.
So if you don't have supplemental insurance, the copay itself can amount to over $150 a day. So people are shocked that you think, well, I'm just going to send them to live in a nursing home. Somebody's going to have to pay for it at some point. Okay, so that can be a huge issue, the financial shock of that alone. And what we found in my experience as a discharge planner and case manager is many times people decline very quickly when they're sent to a nursing home. They feel, they're kind of thrown away or marginalized, and the decline is usually quickened by doing that. If we can keep somebody in their home in a familiar surrounding with the appropriate support, they will have a much better quality of life and may maintain their mental faculties for a much longer time because they're in a familiar area. They're things that they love and know, and their possessions and belongings, and their sense of independence and dignity can be maintained. Home care can be many different levels of care. In the private pay, of course, you would have something from the range of just companion care, okay, with somebody just to come and check on them and take them to and from whatever activities they need to do, helping them shop and those kind of things. Then you could go up to the level of a certified nursing assistant, say perhaps if they need assistance with bathing or those kind of things, or medication reminders. Up to the next step then would be a licensed practical nurse that would do medication checks and those kind of things, and making sure they're appropriately being taken care of. If they have wounds or other medical conditions, they would oversee that, up to the level of an actual registered nurse if there were some complicated wound care or different issues or acute illnesses that required care and teaching. So that level varies quite a bit, and you can design a package working with your home care provider that is appropriate for what that individual needs.
Well, that's great. And I mean, I know just with a simple Google search, you can see there's a lot of different home care companies out there. It doesn't seem we're lacking in any variety of companies, but how does a home user differentiate between the different services and even the different companies? How do you know which ones are more reputable, I guess, is the question.
Oh, yes. In Southeast Michigan alone, I think there's over 250 Medicare certified agencies,
wow.
And Lord knows how many private agencies. And it's really important to make sure that you have a reputable provider. There's many people open a home care agency and they may only have 1 or 2 patients that they make a living off of, or whatever, kind of a mom and pop organization, up to a large hospital associated home care provider. I would say, number one, you can check online. The Healthcare Compare, CMS, would give you some tips to look for. But in my personal experience, you're always better off with a larger agency. Number one, they have the resources to do the appropriate staff training, okay, which is everything in medicine changes frequently, and there's a requirement that your staff be knowledgeable in the latest and the greatest in medicine. There's also, you need to make sure that they have enough staff to cover your needs.
Yeah.
You need to make sure they have the appropriate staff to cover your needs. Do you need just a companion? Do you need a registered nurse? Or do you need something in between? And a small agency that may only have 2 or 3 employees is not going to be able to provide that for you. You also want to make sure that your home care provider does background checks, appropriate licensing is in place, and appropriate training is in place.
Wow.
Because you don't want to do more harm than good. You're allowing a stranger into your home, and you want to make sure that you're not letting a predator into your mom's house to raid her bank account or steal her jewelry or whatever. You have to make sure that you have good, honest, and checked personnel.
And that's really good. You never want to let someone that you don't trust into your home, especially to help a family member that's so vulnerable.
Exactly.
And okay, so once you do all your background information and you dig into everything and you finally decide which company you're going to go with, what type of licensure level are they going to send to the home?
That would depend on the patient's need. That would be also something that you would really maybe consult the regular physician, primary care physician about. The medical needs would be the overall determining factor, the overriding determining factor. Are they a new diabetic? Do you need to teach them how to take their blood sugar? Do you need all these other things? Or do you need, if they're not capable of doing that, who are you going to send to monitor those things?
Sure.
So,
how do they make sure? I mean, we talked a little bit about, do you want someone trustworthy? How do home care companies kind of guarantee that you are getting a trustworthy person, and what do they do to ensure that it's a good fit for a home?
Well, that's definitely, you should, if you're contacting or screening home care companies to provide services, you should have a list of those questions to ask them. How do you background check your employees? Do you train them? How many employees do you have? What type of licensures do you have? How do you check their licensure? Any medical personnel that come into your house, you can check on Michigan.gov website, Lara, to make sure that they have their licensure in place, make sure there's no complaints against them, and so forth. And there are a number of different government websites that do oversight on home care, healthcare agencies in Michigan.
Great. So
And that's very important to make sure that everyone has the proper licensure, and you're kind of you're trying to find a home care company, but you got to interview them. You got to make sure they're the right company for you. So like what in-depth questions should someone be asking the company that they're trying to hire?
Well, number one, I would ask them what their training programs are. How many nurses do they have? How many registered nurses do they have? How many certified nursing assistants do they have? What is the experience of their personnel and so forth? So those would be very important questions to ask.
Yeah, it sounded like a larger company would have more resources, so just come right out there and ask, how big are you? That makes sense to me. So
Don't be shy.
Don't be shy.
Yes.
And you mentioned a little bit ago about, I forget the number, but there's a large number of Medicare agencies.
250, over 250 in Southeast Michigan. Yeah.
So what are some instances where Medicare would pay for home care? I know we talked about that with skilled nursing, but would Medicare pay for home care as well?
Medicare will pay for a very limited number of home care visits per condition. It's strict criteria. You do have to have a doctor's order in order for it to be covered under your insurance. A certification period or an illness period would be only 60 days. In certain circumstances, you could get another 60-day certification period. It's very goal-directed. Medicare has a strict set of criteria that you are teaching something, you're learning something. There are also requirements that the patient be eligible for home care, and that would be it takes considerable and taxing effort for them to leave the home, and there's a few other criteria that they would have to meet before they would be eligible for that. People are often surprised. They think they're getting home care. Well, somebody's not coming to your house to sit there for 12 hours a day. That's not going to happen. You would get a nursing visit anywhere from 1 to 3 times a week, depending on the condition, that would last less than 1 hour. You may be eligible for home health aid to assist with bathing, maybe 2 times a week, and you could get physical and occupational therapy maybe 2 times a week, and that would only last for that 60-day period. Or when goals are reached, then there are specific goals set. Once they learn how to do such and such, then the services would end. So it's very limited what Medicare will cover.
And that's where the private pay would come in. So
they pretty much follow the Medicare guidelines for commercial insurances, but then you could supplement that with private duty as well. And that may be a combination of those things that you would need, to help your loved one have the best quality of life and the best care.
Great. Are there, I'm just thinking of this, for someone thinking, well, all right, I'm ready, this sounds like something, are there resources out there to help someone or another service or something that could help people select the right home care service for them?
Well, the agency that I work for can answer your questions, and you can contact them either by website or telephone number. And there are, as we talked about before, Center for Medicaid and Medicare Services maintains a website, and you can also check on Michigan.gov. They have some resources there as well.
Will case managers recommend it? Are they allowed to recommend a home care company to people? Or is there a rule? I don't know. Sometimes there's
No, they definitely can make some recommendations.
Sure.
It is always the patient's and the family's choice who they want to use. So don't take somebody's word for it. Ask around and make sure that you know what the agency is able to provide you by direct questioning.
Okay. That's definitely very important things. Now, another thing that we have that's common here in Michigan are snowbirds. People who decide that they're done with winter and they want to take off. So how can a family accommodate, having a home health aide or needing home health assistance while traveling and living part-time here and there?
Well, that would be more in the private duty arena, and a good agency will make sure that you have a long-term plan in place that is suitable for your lifestyle, whatever it may be. If you know, I know a lot of my friends transport their parents to and from Florida during certain times of the year and so forth. A good agency, number one, will make sure that you're staffed when you're in Michigan, and say you went to Florida, for an extra fee, of course, you could have their home health aide travel with them, and a large enough agency could accommodate that. Or the agency will make sure that you have a reputable agency in place in your destination point, and vet them and help you staff that down there. And that way there's communication between the agencies. There's continuity of care. If that person has special needs, they'll make sure that's communicated so that your loved one has the best possible care and transition of care.
Oh, that's great. Because I've been on the other end with the family trying to manage it and find this, knowing that, a home care could just really be that one-stop shop to answer all those hard questions and do that for you, I think is incredible. So, we're starting to run out of time. I really enjoyed talking to you. So, one last question we have. If someone has more questions for you directly, where can they contact you?
Well, they can contact me at AmericareMedical.com, and the phone number is, sorry, it's 248-288-2270.
Great. Well, thank you. And again, thank you for being on the show. And Brent and I appreciate it. And hope to have you on again.
It was my pleasure. Thank you.
And for those of you at home, again, if you have any questions or any questions about the content on the show, or for Joyce personally, the number again is 248-288-2270. Or you can email us as well at boomerhealth@americaremedical.com. Thank you for watching.